Well, good afternoon, everyone. I first of all want to thank Jody and thank Catherine for the invitation to participate in this conversation. Um, I think that the area of wound care may be unfamiliar to some people, so I want to share with you some of what this area is first all about. And so I think one of the biggest challenges we face in our healthcare system today is the medical model of treatment and management, and now even a business model or a business rhythm. And I think we need more emphasis on prevention and specifically preventing wounds. We also need to understand that people develop wounds due to underlying chronic diseases. So for example, if I have arthritis, that limits my activity and mobility, putting me at risk for the development of pressure ulcers or bed sores. My arthritis may be limiting my ability to walk, which may cause the pressure on my lower legs to increase, causing me to develop leg swelling, which might put me at risk for developing a venous leg ulcer. I may have diabetes, which affects the feeling in my feet and diminishes my arterial circulation, which puts me at risk for the development of a diabetic foot ulcer. So in wound care, there's always some underlying cause that will need to be managed by a collaborative team of healthcare professionals. And so to put this in another perspective, our changing demographics include a rise in the incidence of diabetes, obesity, and increasing age, all of which are risk factors for the development of wounds as well. And as Catherine mentioned, chronic wounds are costly to health authorities and are a huge financial burden. In the UK, up to 4% of the health budget goes to treating wounds. And I think we don't even have a handle on how many people have non-healing wounds and what it's costing our system here in Alberta. And as I mentioned earlier, there's patients who often suffer with pain and symptoms such as drainage and odor that significantly affect their quality of life. And also, as Catherine mentioned, that the use of antiseptics are now considered a standard of care, as well as evidence-based treatment for people at risk for infection or for those who have chronic wounds that show signs of infection. But I think there's still a lack of implementing this evidence into practice due to education, due to rituals, the lack of resources dedicated to the management of wounds, just to name a few. So this caption here represents, to me, the rewarding and challenging area of wound care. I actually had an artist locally create this image for me. I basically told her that, you know, this is what I do in my job, and this is how I feel about my job, and these are some of my patients. And working with her, she created this this image of their statue for me, and that's just, you know, resonates, and for me that's what I do, and that's how I represent that. So I wanted to share that. And also, I mean, when you meet someone who works in the area of wound care, you'll notice that they're passionate about what they do. And wound care is not just about caring for a hole, because under every dressing lies a story of trauma, of pain, of odor, isolation, infection, never healing, uncomfortable treatments, or a lack of continuity of care. On the other hand, caring for a person with a wound is an opportunity and a privilege to care for that person, to advocate for their needs of the person and as well for the wound. And people are impacted physically, psychologically, socially, financially, as we mentioned. And it takes more than a bandage or a dressing. And wound care clinicians know that it takes a collaborative approach to treating the cause of the wound and managing that local wound while addressing those patient-centered concerns. But it is a challenge, and sometimes there are well-run teams, but other times, and most times in my experience, it's a challenge to ensure that the needs of the patients can be met. And I think in the area of wound care, there's limited access to specialists, limited continuity of care, and an overall, sometimes lack of a standardized approach to wound care. So I think the current status within wound care and in healthcare is that, you know, sure, there's a lot of things that are working really, really well. We have a lot of working groups that are developing guidelines, keeping things up to date, ensuring that that evidence does get into practice. We have a lot of specialists, but I would argue, too, there's not enough of them, and we're not also using them to their fullest skills and fullest extent. There's a lot of structured education being delivered. We have a national wound care organization, the CAWC, the CAET. MacEwan University provides a wound care education program that was mentioned, and Mount Royal University teaches wound care to nursing students. But I think there's some challenges too in the current system, is that we know in healthcare there's lots of wait times. People are seeing generalists rather than specialists. I mean, Catherine, if you had a heart problem, you'd probably go and see a cardiologist, right? So if you had a non-healing wound, you would need to go see a wound specialist. Other challenges in practice is that sometimes in healthcare we have these little silos. Sometimes we're all working on the same thing and we're reinventing the wheel. Sometimes there's a gap, as I mentioned, in the implementation of evidence into practice. And there's challenges in mobilizing that knowledge into the front line. And I think organizations are not aware of the extent of the problem of wounds, and there's a lack of monitoring of outcomes. There's a lack of public education. And I think there's a need to challenge and improve and reshape existing practice in the area of wound care. So the system that I've been working in for the past 25 years, it's working okay, but, there's lots of things that we could certainly improve upon. And that's why a working group is developing a community of practice in Alberta dedicated to improving the way that we do things in the area of skin and wound care by connecting with each other and collaborating together. And I think it's time for change, and it's time to be open to that change.
Very true.
Even meeting Catherine in this industry, I mean, just two people connecting and coming together, and now meeting Jody, I mean, there's this synergy that's created. And sometimes I find that there's no one to bounce off my ideas or questions, but when I work with like-minded people, the ideas start flowing. Conversations start happening. People start connecting. We talk about things that matter to ourselves personally and professionally, and we actually talk and listen and trust and develop new ways of learning when we start collaborating. So by developing a network within Alberta and forming SWAG, or Skin and Wound Alberta Group, I think that's just what's happening. So SWAG, or Skin and Wound Alberta Group, actually started with a lady named Edna Harder Matson, who put a small advertisement in the Alberta RN magazine a few months ago. And I saw that advertisement, and that was the spark for me. So I was immediately hooked when I learned that there was someone out there who was actually thinking the same thing that I was thinking. But I'm sure that there were a lot of other people thinking the same thing, but somebody needed just to start that ball rolling. And unfortunately, Edna had to take a step back from developing this group, but as I mentioned, that's just what it took. It took one person to connect with one other person, sharing the same vision, knowing that there is a need to bring wound care people together to collaborate, to engage, to explore, and to challenge the status quo. It's time to change course and to create a new path. So SWAG is trying to develop this community of practice in a collaborative way. And a community of practice model is rooted in social learning and situated learning. So this allows groups to come together to collaborate, to deepen their knowledge and expertise and experience. There are a lot of wound care people with a lot of experience and a lot of education. And there's also lots of new people who are just starting out in this area, who are looking to connect with others and to learn from their experiences. So there is emphasis on the development of novice and expert relationships, collective learning, peer learning, and social participation, and above all, collaboration. And so I think the pursuit of all of us coming together is to improve care and improve outcomes and to support even lifelong learning for wound care professionals based on working and collaborating together. In wound care, as in anything in healthcare, the patient is always going to be our foremost concern. To improve the outcomes of our patients, we know that a multidisciplinary or interdisciplinary care can improve these outcomes. And within the wound care specialty, our role is also to advocate and educate patients and families so they know how to prevent or how to manage wounds or what to expect from a team of collaborative professionals. And I think it's important that we need to inform the public about these things. So there is a huge need in wound care to engage with the public, empathize with them, educate them, and then enlist them in being involved in this collaborative approach to their care as well. So patients have a right to actively participate as a member in the wound care team, and they have a right to receive timely and cost-effective wound treatment. So anytime a group of like-minded individuals come together to make an improvement, I'm sure they're going to find success and develop some social capital. And I think this capital is created with healthcare professionals and the public together. When we come together, network, share, and collaborate, we can improve the lives of those at risk for wounds, those with wounds, and those for caring for wounds to strengthen our entire community within Alberta. So SWAG is collaborating together with like-minded individuals, but I can also envision SWAG collaborating, once again, with the public, our local health authorities, as well as industry and other professional organizations like colleges and universities, and even the College and Association of Registered Nurses of Alberta, to continue this collaborative synergy as we start coming together as a group. Mm-hmm. And I think at the most basic level, it's time to just, bring like-minded individuals together to connect with one another. I mean, there's so many good things going on, but one of the challenges is maybe we don't know all about all these things that are going on. I mean,
don't know what you don't know.
Exactly. And sure. And it's a challenge for me too, not knowing what's going on out there in the area of wound care. So even I have that need. So SWAG started out and they conducted a survey and asked people the question, what would a community of practice do for you in the area of wound care? And one of the quotes from the survey stated that, well, I want to collaborate with like-minded colleagues, and it's a challenge to keep up with best practice. And we need to improve our communication across healthcare teams related to prevention and treatment. And in healthcare, different disciplines need to come together and work through any type of barriers that might come up somehow to collaborate together. And I think to start off, we should talk about reconnecting as a wound care community, and we need to dedicate ourselves to supporting one another around being purposeful, taking action, and improving the way we do things currently to improve the care for those that actually need it. And for me personally, it's rewarding and exciting to connect with others who share the same passion and commitment to move forward together in this area of skin and wound care. I mean, even this morning, I received a new contact inquiry about Skin and Wound Alberta Group, and this person wanted to connect, to grow and learn and to collaborate. And just seeing these emails come in week by week, it's just really exciting, and it's just exciting to know that people want to come together and start collaborating. So a lot of people who completed the online survey for the Skin and Wound Alberta Group mentioned that we need awareness of all the resources available to us as clinicians as well, where to direct our patients in the community. We know that there are long waiting lists and people are not receiving timely care that they need. So, we need to know what's available within Alberta so we can help meet the needs of these patients. Another gap is that there's a lack of standardized structured education for staff related to preventing and treating wounds. Some of it happens, but there needs to be more done. And a huge gap, as I mentioned at the beginning, is informing the public of the problem of chronic wounds, and that if they have one, they should be receiving that specialist care. Just another real example to make it more meaningful for some people who maybe don't know a lot about wound care. I think the biggest myth in wound care still today is people think that they need to keep a wound dry in order for it to heal. And people need to understand that healable wounds actually need moisture to heal. So if you kept that wound that has the ability to heal moist, it would heal 2 to 3 times faster compared to leaving it dry. I mean, that's basic fundamental information I think that everyone needs to know, and that's just one simple thing that we could do to even try to prevent chronic wounds from happening in the first place. But that's all about awareness, education, and getting that message out there. So the next steps for SWAG, there's a lot of work to do to come together to collaborate, but one announcement in a magazine prompted me to act. and then I put an article in the Alberta RN magazine, once again asking the community, shall we come together and start working together? And I think it's really amazing to have at least 30 to 40 people respond just to that article and start connecting and actually having some conversations via email and coming together in face-to-face meetings and just learning who's in this and who's working together and how can we start growing and collaborating together. And I think that's a great start, because we're all on the same team, and it's time to do some more things together. So the website here is where you can join in and connect with us. We've got a website, we've got an email address and a Twitter account, and we just look forward to connecting and collaborating with more people around Alberta to grow as a community of practice and continue to work together.